Scene script. Ever pondered about empyema? It's a term that refers to the collection of pus in the pleural space, a condition that microscopically reveals a large number of neutrophils. The traces of empyema can always be traced back to an infection. It is most commonly secondary to conditions such as parapneumonic effusions, which account for about 15% of cases, tuberculosis, hemothorax, esophageal rupture, or the rupture of a subphrenic abscess. Considering the clinical features, empyema should always be suspected in patients with a pulmonary infection if they experience persisting or recurrent pyrexia, despite treatment with suitable antibiotics. Systemic features to look out for include high-grade remittent fever, rigors, sweating, malaise, and weight loss, along with leukocytosis and high CRP. The local features may include pleuritic chest pain, breathlessness, a productive cough, and the clinical signs of pleural effusion. Now, to diagnose empyema, several methods can be used. The condition may appear similar to pleural effusion on a chest X-ray, or it could be detected via ultrasound or a CT scan of the chest. Another method involves the aspiration of fluid, where ultrasound or CT is used to confirm the site of the empyema. Aspiration is best undertaken with a wide-bore needle. In terms of management, the approach differs based on whether the empyema is tuberculous or non-tuberculous. For non-tuberculous empyema, a wide-bore intercostal tube is inserted under radiological guidance and connected to an underwater seal drain system. Empiric antibiotic therapy, such as intravenous cefuroxime and metronidazole, should be started and continued for 2 to 4 weeks. In resistant cases, surgical decortication may be required. For tuberculous empyema, treatment begins with antituberculous therapy and aspiration of pus by a wide-bore needle. Often, intercostal tube drainage is also required. In summary, empyema is a secondary infection leading to the collection of pus in the pleural space, with symptoms ranging from high-grade fever to breathlessness and chest pain. Diagnosis can be achieved through various methods, including chest X-rays and fluid aspiration. The treatment varies based on the underlying cause, but it often involves antibiotics and drainage of the infected fluid. This wraps up our discussion on empyema. Understanding this condition, its causes, symptoms, diagnosis, and treatment is crucial for anyone in the medical field, especially for those dealing with pulmonary infections.